It's not ethical to sterilize kids. I mean, if sterilization is a risk potential, there's no institutional review board or safety committee that would allow that protocol to get off the ground. So you can't do it. It's not ethical.
This brings me, I wasn't planning to ask this, but this brings me to something I tried to slip into an op-ed and they made me take it out. I frequently say that gender-affirming care, so-called, this whole puberty suppression experiment, is as harsh as cancer treatment, in that when I was looking at the literature, pediatric fertility preservation, the only literature I found was on oncology and gender medicine. And there's with disorders of sexual development, but that I think is a naturally occurring infertility. And so there's only two areas of pediatrics where you'd sterilize a child, and that's cancer treatment and gender medicine. Am I correct?
That you are correct.
Right, that's what I thought.
And so you could say, as they tried to say, well, you're saving the life of this child who will die if you don't do this for them. In the cancer, that's pretty obvious. If the cancer doesn't kill them, it will certainly make them incredibly dysfunctional in so many ways in their life, really miserable. So there is a justification for saying we're going to keep you alive by accidentally sterilizing you because the treatment we're giving you is going to knock out your ovaries or testicles. They will not be functional. Or we're going to use radiation in the area of the neck for Hodgkin's lymphoma, and that's going to knock your pituitary gland out, and we could possibly induce sort of an artificial circumstance, but you're never going to ovulate as a female. We may be able to do a workaround on those cases, but when the ovary or testicle is destroyed by the chemotherapy, it saves the life of the child, then that's a whole vastly, because the myth of saving a child's life from suicide has been busted so wide open irreparably that, if somebody says that, you just need to shake your head and say, I think you need to go back and basically look at reality.
Well, that's precisely what I was writing about. I was saying the collapse of the transitional suicide narrative has removed all the medical justification for this experiment, because the only medical justification they ever had was transitional suicide. It's life-saving care.